Hello, everyone, and welcome to today's Third Thursday webinar from the Michael J. Fox Foundation. I'm Dave Iverson, contributing editor at the Foundation and the host for this continuing series of topics where we take up different aspects of living with Parkinson's disease. As always, we would welcome your questions during our webinar today. You can just type them in the box that appears in the middle of your screen and send them to us, and we'll do our best to cover as many of those questions as we can. Also, as always, there's our resource list, so you can click on that also on your screen and download that if you'd like to save these slides for future reference. And there's some tips, of course, on the screen too. If you run into any typical technical difficulties, you can reference that over the course of our hour. Today, as you can tell by the name at the top of the screen, we're going to do something a little bit different. Normally, we tackle topics that have to do with different aspects of Parkinson's research or the latest in disease treatments or some aspect of living with the disease. Today, we're asking a different kind of question, as you can tell, what's going on in Washington. And if we discover the answer to that over the next hour, we'll be doing really, really well. So let's get started and talk about our specific topic today, which is, of course, focused on the ongoing debate in Washington over health policy and healthcare reform. So we're going to talk more generally about how public policy impacts all of us in the Parkinson's community. We'll talk very specifically about the ongoing healthcare reform debate. I say ongoing, even though, of course, it's sort of everything's on hold at the moment after the last repeal efforts failed in Congress. But no doubt it will come back again, and we want to talk very specifically about that. But we also want to go beyond just that ongoing debate in Congress and talk more generally about investments in research and why they're so crucial to developing new therapies and of course, we hope eventually a cure for Parkinson's, and also what the role of community advocacy is, why it's critical that we let our lawmakers know about the needs and priorities of those of us who are living with Parkinson's disease. We have a great panel, as always, to deal with today's topic, and so let me introduce them to you. Joining us is Joe Narciso. Joe has been a longtime advocate for our common cause for living with Parkinson's disease. He himself was diagnosed with Parkinson's back in 2003 at the age of 34. Joe, welcome. Thanks so much for being part of our conversation today.
Thanks for having me, Dave.
Pleasure to have you. Joining us as well is Tiffany Kazuba. Tiffany is Vice President of CRD Associates, works actively in Washington, D.C. on a variety of healthcare issues, including working for us at the Michael J. Fox Foundation and helping present our views to those in Washington. Tiffany, thanks as well for being part of the conversation.
Happy to join you, Dave. Thanks.
And Ted Thompson joins us too. Ted is, of course, our Senior Vice President for Public Policy at the Michael J. Fox Foundation. Ted, welcome to you as well.
Thanks, Dave. Glad to be here.
All right, let's go ahead and dig into our various topics. And we've broken this first slide into the different aspects of public policy that the Michael J. Fox Foundation focuses on. And so we see on the screen furthering Parkinson's disease research, supporting drug development and approvals, and then, of course, critically for those of us living with the condition, making sure there's access to adequate care and supporting those efforts, all throughout our Parkinson's community. Ted leads the team at the Michael J. Fox Foundation that works on this public policy arena. And so, Ted, let's get started with your kind of giving us an overview, because these three circles, although they're presented separately on the screen, in a sense they all intersect, and they all intersect in Washington, D.C. So give us a sense of what our overall policy efforts are aimed towards trying to accomplish these days in Washington.
Yeah, thanks, Dave. There really is a continuum, even though it may seem like they're distinctly different, but they really do tie in together. And a key component of public policy work and advocacy is raising awareness and educating elected officials and staff about a whole host of issues and why they're important to the community. On the Parkinson's disease research aspect, of course, that is hoping to drive to additional therapies and ultimately a cure. And that's where the drug development ties in. And then, in the meantime, as people live with the disease, access to quality, affordable health care is essential so that people can live the best life they possibly can. And so we work on all three of those areas because we want to make sure that Congress understands the importance of scientific progress. We are fortunate that we can do it with language of a partnership because of how much the Michael J. Fox Foundation has funded in research itself. But that research depends upon the basic research that the federal government funds through the various institutes at the National Institutes of Health. The FDA is the agency that is responsible for drug approvals, and so we weigh in on those issues with Congress in terms of making sure they have the resources, the money and the person power that they need in order to speed approvals and do the kind of critical analysis necessary for those new treatments. But as I mentioned, prior to a cure, people live with a disease, and our population tends to be an older population overall, and we have found that 80% of our folks are actually on Medicare, and then up to 1/3 of them are eligible for Medicaid as well. And so those two health programs are critical for our community. So we continue to monitor those programs and seek ways to try and improve the coverage and services that are available to people with Parkinson's. We work on a number of other issues along the way, but those are kind of the big bucket issues.
Right. And we'll be talking very specifically about the impact of potential additional reform or repeal efforts and how they play out for people on Medicare and Medicaid throughout our hour. I want to follow up with one question to you briefly, Ted, and then I want to get Joe Narcisso's point of view on what people living with Parkinson's can do in these three broad areas, because it's not just our team of people at the foundation that's critical to this. It's obviously a broader community. But before we hear from Joe, Ted, I want to underline one point you just made, which was that one of the strengths of our efforts lies in the fact that the Michael J. Fox Foundation does a lot of funding of research itself. So it's not like we're coming to Congress just with an open hand asking for, please help us. We're almost an equal funder of Parkinson's research as the National Institutes of Health. Would you just round out that point a bit more? Because I think it's crucial to our ability to make our case.
Yeah, it really is helpful for us to be able to tell that story. Since our inception, we have now funded $750 million with a B dollars in Parkinson's research. This year, we may actually fund as much as the NINDS, which is the institute that does the primary research in Parkinson's. So being able to go to Washington and to tell that story is impactful and helpful, but we also do caution that this foundation and the other Parkinson's organizations in the United States and worldwide cannot be relied upon to fill gaps that the federal government should be filling. There's also a huge economic imperative for Congress to fully fund and increase funding for the NIH, because it drives not only great jobs and driving the economy, but it maintains the leadership position of the U.S. in this field. And so being able to talk about the partnership that we provide, and we work closely with NINDS and several other entities, including the DoD, with Parkinson's research funding, being able to tell the story of a partnership is strong. Thank you, Ted.
And Joe, just add from your point of view as a community advocate who's been working on these issues for a long time, that how important it is for people in the Parkinson's community to take an active interest in these big public policy issues. We're all, of course, focused on what can we do to live better with this disease, but part of the answer to that question is in embracing and being engaged with these public policy questions. Someone wrote in before our webinar starting, what can we do in our community besides fundraising? I think you're an example of the kinds of things that can be done beyond fundraising, as important as that is. Can you just speak a little bit, Joe, about the importance of community members being involved in these larger public policy issues?
Sure, Dave. I've been advocating since 2005, and I consider it the most important thing I do in my life. It's building relationships with these congressmen and women and the senators, and really, telling our own personal stories as to how this disease affects us and how federal funding can help us. And it's not just, and you really can build real relationships with these legislators. An example I like to point to is Cory Booker I'm from New Jersey. Cory Booker was introducing some caregivers legislation, and my wife Charlene and Myra Hirshhorn, who are both advocates, were their opinions and some of the things that they spoke to Cory about were included in the legislation. On the congressional side, Leonard Lance, who is my specific representative in Congress, we've met with him, dozens of times at this point, both on Capitol Hill and here in New Jersey. And when it came time for the House bill to be voted on, he was one of 20 representatives to vote no on the Republican side. So it really makes you feel like your voice is being heard, your story is being valued, and you're really making a difference.
Thank you for those efforts. It does speak, I think, dramatically to the kind of impact that people can have. Let's push ahead and talk about where we are right now in this ongoing debate, and ask Tiffany Kazuba to kind of give us a kind of eagle-eye view on where things are. We all know that there was this effort to repeal and replace the Affordable Care Act, often known as Obamacare, and that to date those efforts haven't been successful. And so take us from this point where we are now, Tiffany. I think everyone's wondering, including some people who are writing in right now to our webinar, saying, what's going to happen next? What will the next proposed legislation include? Give us your sense of where things currently stand.
Happy to. Thanks, Dave, for that question. So as everybody knows, the process that was going through the Senate failed in a 51 to 50 vote, with John McCain providing the extra vote to put us over. In response to that, there are some efforts in the House of Representatives to bring up the legislation that they had passed in 2015, which would fully repeal the Affordable Care Act, including provisions that protect people with pre-existing conditions, so all of the Parkinson's community. However, it appears that those efforts will be in vain, as the Senate was unable to even bring up that bill for consideration. However, in light of the failure in the Senate, there has been some efforts in the Health, Energy, Labor, and Pensions Committee in the Senate to work on some bipartisan fixes to the legislation. To this point, they haven't put together any specific legislation that we have to analyze for people, and it's unclear if there's a path for that legislation to pass given the current climate. But those efforts will be what Michael J. Fox Foundation and the rest of the health care advocacy community will be watching for the next few months.
I'm glad, Tiffany, you mentioned the word bipartisan, because it's important that we not think of this as necessarily a Democrat versus Republican question, or that we're aligned with one party versus another. Joe Narciso, let me ask you to comment on that, because we talked about this the other day on the telephone, and you made some really good points about what's most important to people living with Parkinson's is not necessarily preserving the current law as it is, but making sure that certain provisions, which are crucial to those of us living with Parkinson's, are maintained. Can you just add to that point a bit more, please?
Sure. Obviously we are all a pre-existing condition, but one of the things that's most personally worrisome to me is I'm a DBS patient as well. And if I don't have access to health care when I need a battery changed or something goes wrong with my DBS, it's literally turning me off. Obamacare, the Affordable Care Act, is not necessarily a perfect system, but the protections that it offers we in the Parkinson community are vital and actually quite literally life-saving.
And Ted, from your point of view, can you also say something about the way in which you try to negotiate these points so that it's not coming across that the Michael J. Fox Foundation is aligned with a particular party, but we're aligned with our community. We're aligned with what the people in our community need.
Right. Well, and what's interesting is when you talk to lawmakers and their staff about some of the key provisions of the Affordable Care Act, without using the phrase Obamacare or ACA, they agree with it. The non-discrimination based on pre-existing conditions, annual and lifetime caps, and a whole host of other provisions. And so, unfortunately, our healthcare system has gotten, wound up into a very partisan political battle, and looking out for the interests of the American people probably isn't even secondary. And so, my hope is that that the efforts moving forward will be bipartisan. We, in our communications to Congress, with our action alerts that a lot of people on the call here sent, and phone calls and things like that, have focused on those key provisions important to our community. And in my communications to Congress, especially the Senate, we're much more technical and detailed to convey to them the importance of various aspects of the current law. We've never endorsed the Affordable Care Act or anything like that. Our focus has always been on the provisions within the law that impact our community. And the other thing that a lot of people forget in the frenzy that seems to surround healthcare is there are a lot of pieces of the Affordable Care Act that, if it was repealed, would be devastating. We've already mentioned a couple of them, but for example, the Medicare donut hole is scheduled to be closed completely, and that directly impacts the finances of any of you who are on Medicare. There are some elements of the Affordable Care Act that we think should be repealed. In particular, there's a board that has to make automatic cuts to Medicare if Medicare exceeds its budget, and so there are things like that where it could, that type of a dramatic cut could actually impact, people with Parkinson's and obviously other diseases. But so there are pieces of the law that we think should go away. There are other pieces that they really, when they passed this law, it was not in finished form, and so it's been a very difficult law to implement completely and properly, including the subsidies that you hear President Trump refer to, the bailout for insurance companies. And one can have a discussion around whether it is a bailout or isn't a bailout, but right now those payments to the insurance companies is basically a subsidy to ensure that cost sharing and premiums don't go through the roof.
Right, and
Ted,
he made that payment.
Go ahead, Joe.
I'm sorry. Yeah, and the president
did
agree to make the payment. The president did agree to make the payment for this month, which he had been threatening to withhold.
Thanks for that update. Paul writes in a question which is on point with what we're currently discussing, which is simply opposing repeal of the Affordable Care Act can come across as just a broad partisan position. So what are the specific aspects of the ACA that are the ones we make sure don't get lost? We've talked about a couple of them, pre-existing, preserving the ability for people with pre-existing conditions to have access to insurance is obviously perhaps the most critical one. But Ted, could you name a kind of 1, 2, 3 in terms of the current provisions of the Affordable Care Act that are the most crucial from the point of view of someone living with Parkinson's to be maintained?
Sure. Well, one example is current law requires a base, it's called the essential health benefits, but it directs all insurance companies that they have to provide a certain set of benefits, including things like drug coverage. So if that went away, the drugs people use for Parkinson's may no longer be on a formulary for their insurance company. So that's one example that would actually hit people directly. Another provision is there's a limit on how high an insurance premium can be between young Americans and older Americans. It can be for an older American, the premiums can be no more than 3 times what the younger Americans are charged. And if that provision went away, then we go back to rating people based on their health condition, which again would result in skyrocketing premiums and cost sharing for people with Parkinson's. And back to the partisan question of opposing repeal. Our intent from the beginning was never to, well, not never to take that position, but we earnestly wanted to work with the Congress, the House and the Senate, to improve the system. And in the House, they at least had a few hearings. They really didn't make alterations that the patient community wanted in their repeal efforts. But in the Senate, there was absolutely zero intent to listen to the patient community. There were no hearings. There was no testimony. There were no expert witnesses. They weren't even waiting for the Congressional Budget Office to give them the score on how much this would cost and how many people it would impact. And so we've said from the beginning, and we'll continue to say, that this should be done with Democrats and Republicans working together and keeping patients at the center. I mean, that's why we have a healthcare system, is to provide care for patients. And the patient community was completely ignored, and so we hopefully the Senate's got it out of their system, and that when we come back in September, that some real bipartisan work can be done.
And Tiffany, what are the prospects for that of the committee? People talk sometimes about the Congress returning to what's sometimes called regular order. What are the prospects for this people actually going to work now in committee? Because I think that would be helpful for us to hear a little bit more about, and might also say something, and Joe, you could then comment on this, about where people ought to next direct their advocacy efforts. If it is going to be at the committee level, then obviously the representatives who serve on those committees need to be hearing from all of us.
Yeah, so we're, just to be clear, Dave, we're talking about return to regular order on healthcare specifically, or overall in Congress?
No, I mean on healthcare specifically, and the prospects for that occurring in terms of work being done in committees on healthcare.
Yeah, so according Senator Lamar Alexander, who's a Republican from Tennessee, and the chairman of the committee that would address this, did announce right before the Senate left for recess that the committee would be holding bipartisan hearings throughout the month of September. I think it's important. It's important to see them coming together on this and starting to talk about real solutions to the healthcare crisis. There's also a group of 40 bipartisan members of the House who've come together to endorse an outline of ideas at making fixes to the ACA. I think as far as the prospects of something actually being done, I think it's very difficult. However, if they are able to focus on very specific things, such as the subsidies to insurance companies to lower premiums, such as support for the exchanges, and ensuring that there are enough insurance companies throughout the 50 states and that everyone has access to health insurance. With the counties in which I live, I'm sure people have heard the reports on the news of some counties being without health insurance plans at all. If they can target those small, very specific policy issues, I think there's a lot better prospect of them actually being able to move forward on some small fixes. However, given the current environment and depending on what really happens before they're able to put out a new health care bill, I think that's really where, I think the politics are really where a lot of it lies. Ted might want to also add to that.
And before Ted, we hear from you. Let me just ask Joe for his kind of advocate's advice here, because if there is at least a small chance that some work could get done at the committee level, I assume, Joe, that means that people should be really tuned in to whether or not one of their representatives are on some of those key committees, like Senator Alexander's committee, for example. How would you encourage people at this point in the process, where we're sort of back to square one, to get involved?
Yeah, the big thing is to know who your representatives are, what committees they're on, and what resonates with them. In my district, again, Congressman Lance's district, there's a lot of pharmaceutical companies. So these issues are very real to him and on a practical basis in terms of his constituencies. But, you know, there's a feeling amongst the advocates a lot that we should just be saying thank you to the Democrats and please help us to the Republicans, but it's not that easy. I mean, I think you know, we should be saying thank you to the legislators that support us, but we should also be saying don't stand idly by and just protect the ACA, work to fix what's wrong, and to encourage them to not put a party over policy or people. You know, when we tell our own personal stories and we put a face on the situation, whether we're in their office or whether we're at a town hall or whether we're wherever we are when we're meeting with them, you know, those stories are really what resonates with these legislators, because they're people too, and generally they know someone who is ill, whether it's, even if it's not with Parkinson's, whether they know someone with cancer or Alzheimer's or things like that. Putting a face on these stories is most vital.
Well put, Joe. Thank you. And Ted, I know that's a point that your team really emphasizes as well. But Ted, you also wanted to add something to the question of kind of where things will go next, perhaps in Congress.
Yeah. First, I'll piggyback on Joe's comment, because you know, there isn't a Republican version of Parkinson's or a Democratic version, and so we you know, really try to avoid the partisanship aspects. You know, what is also a little different for our community is when you hear the word Obamacare, that typically is a negative reference to these health insurance exchanges and things like that. Well, we don't have a lot of people that are affected by the exchanges, because the vast majority of our population are either on Medicare or Medicaid, or the younger folks that are still working have employer-based coverage. And so that's where the critical stuff for us were the health insurance reforms that we've talked about. But in terms of what's next, we were crafting our messaging for the Senate Help Committee, which right now is planning to hold hearings the week of September 5th, to begin the process of putting together a bill that would fix some of these problems, like the subsidy to the insurance companies. That's actually not in the law per se. It's up to the administration to make those payments, and that's why the president can threaten to withhold that money. But if he does that, even though we don't have a lot of people on the exchanges, the impact would be that will, you know, dramatically destabilize the insurance industry, and the projections are that people's premiums will go up 20% next year, 25% the following year, and it would be really, really devastating. So, you know, you know, these people are politicians that have to stand for re-election, and that type of a massive disruption to 1/5 or 1/6 of our economy, you know, is going to have some repercussions for them. And so, while we don't get involved in politics, we have to be paying attention to it, because it can impact policy. And our community was very active, as were many others. You see on the screen, over 26,000 emails were sent about this issue. We don't have an accurate account on how many phone calls were made. Phone calls tend to have a little bit greater impact because you took the effort to pick up the phone and call. I mean, it doesn't seem like much, but definitely telling that personal story, getting that relationship. Because what we want is for these members, when they take their vote, they want to remember, they may not remember Joe's last name, but we want them to remember Joe's story. And the story of a caregiver talking about, what it's like to provide care for a loved one, or the son or daughter of somebody with Parkinson's saying, this has kind of impacted my ability to have the kind of relationship or life I thought I'd have. So, stories from anybody impacted by the disease are powerful.
Thank you, Ted. Let's get to our next slide, because we haven't talked a lot yet about where our funding priorities are and why they're so particularly crucial. So let's go through a few of these, and then I want to start taking all of your good questions that are coming in so far. We see on the screen, where federal funding is particularly crucial for Parkinson's disease research, both within the National Institutes of Health, and Ted referenced earlier the National Institute for Neurological Disorders that's within that wing of the NIH. We'll also talk some about the registry and other programs within the Department of Defense. But Tiffany, let me bring you back in and ask you to give us a bit of an overview on this, because we work on these things kind of in concert with numerous other health organizations, so that we're not just we're not trying to pit Parkinson's money against cancer money or whatever it happens to be. Can you just give us kind of that picture of why it is that we work together with a variety of health organizations to try to increase funding that will particularly help Parkinson's, but we're also not trying to make sure, we're trying to make sure rather that we don't, pit one disease off against another.
Absolutely. And here in DC, we talk about the public health continuum and the importance of all health programs that the federal government funds in protecting Americans' health, especially because I'm sure, as most patients with Parkinson's disease are not only dealing with one symptom of a disease, and in often cases not just one disease. So it's important that we invest in all of these types of federal activities in the health space. To understand the environment down here with regard to funding and why it's so important to work together, in 2011, Congress passed what we call the Budget Control Act, which placed arbitrary caps on the amount of funding that Congress can choose to spend each year. We call these programs non-defense discretionary programs, but all that really means, or NDD programs, all that really means is the money that the federal government Congress chooses to spend each year that's outside of programs like Medicare and Medicaid, those entitlement programs that we were talking about earlier, and outside the Department of Defense. Although there are also caps on the amount that the Department of Defense can spend, which also impacts the Parkinson's research program at the DoD. These arbitrary caps in addition to these arbitrary caps, the Budget Control Act also implemented sequestration, which further reduced those caps. Currently, Congress is working on a fiscal year 2018 budget. So fiscal year 2018 technically starts on October 1st. However, they're working from a budget that actually, in the House, uses even lower numbers than what is written into law, and in the Senate uses the current funding levels. What this means is there's not a lot of money available to increase funding at the National Institutes of Health, and then and then below that, NINDS, because the pot of money is not that large. So Michael J. Fox Foundation and many health organizations have joined together to fight for increased overall funding, and specifically increased funding for health programs, so that there would be enough money available to increase funding at the National Institutes of Health, and for something like creating a neurological disease registry at the Centers for Disease Control. Under current funding, there's just not enough money available to even create new programs.
Right.
So that's something we have to work with the rest of the community to do.
Tiffany, let me just interject for a moment because we're getting a little bit of feedback, a little bit of an echo effect when you're talking, and maybe because your computer isn't muted. So just want to ask if you can see if you can attend to that, and that might help the overall audio quality on the webinar overall. So I'll just ask you to work on that for a second and bring Joe back in to talk a little bit about what Tiffany was just identifying, which is this national disease registry, which has to do with this question of not really knowing out there how many people really do in fact have Parkinson's disease. It might seem like a small point, but I know, Joe, it's important, and you have a particular perspective on that I'd like you to offer.
Yeah, one of the things that if you think about it, you have to register your dog or your cat. And so we know how many dogs and cats there are in the country, but we don't know how many people have Parkinson's disease. And when we meet with our legislators, they often ask, well, how many people have Parkinson's? And the numbers are, generally, 1.5, to 2 million people. But we have no real hard data on that. And it's really important to get those numbers so that we can get the funds allocated that we need.
And Ted, on the last point, we've talked some about NIH as well as now Joe's comment about the registry and why that would be so useful. We haven't talked much about Department of Defense, and this seems like a kind of oddity in a way. Why is it that the Department of Defense would have a specific program that has to do with funding Parkinson's, has to do with things like Agent Orange and other kinds of exposures to people in the military that have later led perhaps to Parkinson's disease. But can you comment on why that's a particularly useful funding stream for our broader community?
Yes, it actually is the only Parkinson-specific funding stream in the entire federal budget, and so that's important that we keep it funded. And the reason the program was established originally was because of a connection of serving in the military and Parkinson's disease. You mentioned Agent Orange. That is a service-connected disability. Late last year, the Secretary of the VA, Veterans Affairs Department, ruled that if people served at Camp Lejeune for a 30-day period, consecutive or non-consecutive, during about a 20-year window of time, that if they had Parkinson's, that they would be service-connected disability because of all the contaminants and things like that. On the DoD program, we engaged with them, and actually we were the catalyst to get a joint meeting of NIH and DoD along with us and the Parkinson's Foundation to talk about priorities and how we could be more effective in using the funds of the DoD program. And we're moving more into the direction of environmental aspects of Parkinson's because that really is where the military service tie-in exists. So, our view, and we're talking a lot about all this money for healthcare, for research, and some people on this call might be thinking, oh my goodness, we can't just ask for money. Part of our goal is to make sure that the money is spent efficiently, effectively, in the right quadrants, because we're all taxpayers and we should all demand value for our tax dollars. And so that's part of our messaging too, and that's one of the reasons we really push to get the DoD and NIH talking to one another, because they really hadn't been coordinating previously. And real quick on the disease registry, one of the advanced questions that came in was whatever happened to S849, the Advancing Research for Neurological Diseases Act. That is what we're talking about when we're talking about the CDC program. It was enacted as part of the 21st Century Cures Act last year that I had the honor of being at the signing ceremony with President Obama in December. So that program on paper exists. And we have already started conversations with the CDC on how that will get established, because we want to make sure that they have the experts from the Parkinson's community at the table helping to design whatever the CDC sets up. But Tiffany referred to the budget caps. That's where the big hang-up is. While the law, the 21st Century Cures Act, established this surveillance system or registry at the CDC can't do anything to set it up if they don't get money. And so now we're focused on trying to get the $5 million that Congress authorized through the current budget process. We have to get $5 million so the CDC can actually set the system up.
Yeah. And Tiffany, let me bring you back into the conversation. Thanks for doing your best on trying to solve the audio problems. It's apparently not your computer that's causing the issue. We're not quite sure where the gremlin is, but there often seems to be one. But let me ask you a question just the same, which is people are probably wondering, well, with so much uncertainty right now, and we don't even know if anything's going to go forward or whether anything will ever happen with repeal and replace and all the rest of it. What happens then? And so I guess Congress has to come up with a budget. We see on the screen here that the budget for fiscal 2018 is coming up. Will this, in the end, mean that we'll have kind of the status quo, that funding for these things that we have up on the screen, whether it's the NIH or the registry or the Department of Defense, will sort of stay the same? Is that our kind of best case scenario? What can you tell us about that aspect of all of this?
Yeah, so that's a good question. So to start off, at least for December, because neither the Senate or the House has passed a budget, they have started moving somewhat on starting to say how they would spend their money, with appropriations bills having been written and released out of the House and some in the Senate. However, it does not seem likely that the bills as they currently stand will be final legislation, nor does it appear that they'll actually have all of the budget and appropriations process wrapped up by the deadline, which is the last day of September, with new funding starting on September 1st. So what they'll likely do, at least in the short term, is pass what we call a continuing resolution, which just continues federal funding at current levels for a designated amount of time. We anticipate it'll be 2 or 3 months, and that will give Congress a little bit more time to work toward a bipartisan budget deal that raises the caps to make more money available for increases at the NIH and may make money available for the Neurological Disease Registry. So I don't think that Congress will have appropriations wrapped up until later in the fall, if not the very early winter. So it's really important over that amount of time that Parkinson's advocates and advocates in general are talking to their members of Congress about what their funding priorities are, especially if your member of Congress sits on one of those appropriations committees, either in the House or the Senate.
Yeah, great way to point that out. Thank you. Let's. I'm going to put up on our screen now sort of some summary points and use the last 15, 20 minutes of our conversation to take up all of the questions that are coming in from a wide variety of our participants and on a wide variety of issues. Here's something that Ted, maybe you can take a question that's come in from Alex, which is an area we haven't really talked much about yet, which is what's going on at the FDA right now with regard to the accelerated drug approval process?
I would probably need more detail to answer that. More generally at the FDA, one of the problems with just accelerating the process is that they have been short-staffed to the tune of about, I think, 900 vacancies. And the 21st Century Cures Act there were certain provisions in there to basically bypass some of the federal government rules around the hiring process so that they can really accelerate hiring the people so that this backlog of drug company and device company submissions can get up to speed. And the new commissioner, Gottlieb, he seems to be extremely focused, rifle focused on clearing up the backlogs and also promoting generics, because he's talked about how there are 180 branded drugs that no longer have protection, yet 150 of those drugs have never had a generic application. And so he's working to highlight that to interest companies in creating more generics, which ultimately will bring down the cost of drugs.
Right, right. Useful, thank you. Here's a question that maybe you can field, Joe, from Karen. It has to do with caregiver questions, which is, I know, an interest of yours. Her question is, what about policies on caregiver access and caregiver payment? I'm not sure exactly what that refers to, but one of our ongoing concerns, I know, has been to try to get Congress to be more cognizant of the challenges that people who are care partners or caregivers to those living with Parkinson's have. Any thoughts on that, Joe?
Yeah, here in New Jersey, Lisa Griffin is a caregiver. Myra Hirshon is a caregiver. My wife Charlene is a caregiver. And we've been out there for years speaking to our elected officials. And when I think I mentioned this at the beginning of the webinar, when Cory Booker a couple of years ago was going to introduce some caregiver legislation, he met with us and he took 2 or 3 suggestions that my wife made and Myra Hirshon's story and Lisa's story resonated with them, and they included elements of what we spoke to them about into the legislation. So what I would say is it's as important for the caregivers to be involved as it is for the patients.
Ted, anything you want to add on the caregiving question? I know that's been a priority within your public policy portfolio.
Yes, it really is critical, and we're working with other organizations, to try and get some meaningful caregiving legislation enacted. It's a difficult thing right now because of the budget issues. But for example, AARP comes out every year, maybe not every year, but they come out with a report on how much family caregiving is provided in this country, and it's roughly $470 billion, again, billion with a B. So it's a huge burden on American families, yet there are no real meaningful tax breaks or anything like that that would help people that are providing this care. There is some legislation about to be introduced. It'll be introduced in September that would allow people to use their health savings accounts to help pay for for home care, which might provide a respite for the family caregiver. Of course, that's only good if you have the means to put money into a health savings account. Other ideas that have been tossed around, for example, if you have to give up your career for a period of years in order to care for someone, you may not actually earn enough quarters in Social Security payments to qualify for Social Security. So, that is really, it's beyond unfortunate. It's kind of mean. I mean, if somebody cares for their loved one and the end result is they don't get Social Security because they did the right thing, that's really not the result we want. So, but getting Congress to focus on this right now is not easy. But that's also all the more reason why we need more caregivers getting involved, because these are really important issues.
Yeah. Joe, here's a great question from Sam that I apologize, Sam, for not getting to this sooner. This is kind of a basic baseline question. And Sam asks, could you please explain pre-existing condition? What does that mean? Why are all people with Parkinson's considered to have a pre-existing condition? You want to take a flyer at that, Joe?
Yeah, what it means is that an insurance company can deny you coverage based on a pre-existing condition. So theoretically, if you have insurance, they can't drop you. But if versions of the law pass where they can, then it's not just Parkinson's. There was a list that was put out which had dozens, if not hundreds, of conditions. And the insurance company can discriminate against you because you have Parkinson's, so they can deny you coverage. They can increase your premiums so that it's prohibitive for you to get insurance at all.
So if you have a condition like Parkinson's, and let's say you lose your job and now you want to try to get health insurance in the old days, if you already had a condition like that, an insurance company would say, no thanks, we don't want to take you on. If that pre-existing condition is allowed to discriminate, then we have that circumstance. But one of the things that the Affordable Care Act fixed was saying that couldn't take place. But Sam, thanks for raising that really key question. One of the other issues that's come up that people have asked questions about, and Ted, maybe you can go respond to this, has to do with Medicare and Medicaid. One person wrote in before the webinar, I'm disabled and receive SSDI, which is Social Security Disability Income, also receive Medicare. Do I need to worry about losing those? Someone else asked about, well, what does this mean if I'm on Medicaid? And of course, we know that one of the possible reform efforts was to keep Medicaid expansion from moving forward. What about the risk level, I guess you would say, Ted, for those who are either on some kind of disability income, Medicare income, or Medicaid, which is health insurance for people who have lower incomes?
Well, I would encourage you to keep a close watch on all of those programs and what Congress is proposing. So far, nothing has happened, and most politicians say we're never going to hurt those programs. Well, one of the proposals that there are so many different healthcare proposals in the last few months, but one of them not only would have eliminated the Medicaid expansion, which is a key part of the Affordable Care Act, but it would have further turned Medicaid into a block grant, and that would mean that the amount of money available for a given state would be determined by a formula, but over time that money would likely shrink. And so it would mean that Medicaid programs at the state level would have to either decrease benefits or change the criteria under which you qualify, things like that. SSDI is a lifeline for a lot of people, and that too continues to come under some threat. Occasionally you hear stories, or there's a news story about people, fraudulently getting access to SSDI, and that does happen. And those people should be kicked off, and the attorneys that are helping to get them onto SSDI should be, punished. That said, it's not like 80% of the people on SSDI shouldn't be, or anything like that. So what we would, be willing to support would be, ways to ensure that only those people who truly need it are on SSDI, as opposed to, it's the old phrase about we should take a scalpel to it, not an axe. And so we want to make sure that all these programs, of course, there are ways to improve them, make them more efficient, modernize them. One of the things that we haven't done a good job in this country, for example, like electronic health records. And so our systems don't talk to one another in a way that, pretty much every other industry systems can. And so there are a bunch of different things that we could be doing if we were focused on good public policy and improving programs. And some of those improvements could actually result in savings to the program.
Tiffany, here's another question on drug pricing. Maybe you can respond to. Ted was talking earlier about the new commissioner at the FDA being interested in promoting more use of generics. The question has come in as, what else are we doing to encourage lower drug prices. This is obviously an issue that affects all Americans, whether you have Parkinson's disease or not. So I'm curious, again, from your position of someone who's working on advocating things across a coalition of a variety of health organizations, is there a sort of consensus view within the health community about what could be done that would help lower drug prices?
I think to Ted's points, generics are definitely an agreement in the health community. I'm not sure that I've been witness to, through this point at least, a consensus view amongst the health community on drug pricing. I mean, I kind of want to deflect to Ted if he has some more insight, but as far as my coalitions go, I mean, there's a little bit of just, it's very hard, as with the healthcare system writ large, it's really difficult to get everybody on the same page with regard to a response to drug pricing in general.
Yeah.
I would like to deflect to Ted if he has anything more concrete.
Yeah, Ted?
Yeah, I think the direct answer to your question about whether there's a consensus is a firm no. You know, this is an extraordinarily complicated area because, you know, it involves so many different players, and there's just no silver bullet. You know, there's talk about Medicare negotiating drug pricing that could have a positive impact for the cost of drugs to the Medicare program. But then there, you know, drug reimportation. There's a host of different types of proposals that are put forth, but most of them aren't realistically, you know, they're not supported by a broad enough number of legislators to pass. The other thing, you know, another key piece though is whatever we do around drug pricing, we can't do it in a way that disincentivizes research and drug development. So that is a major concern, and that's not trying to be an apologist for the drug companies by any stretch, but it's recognizing that if we go too far, it could actually, you know, create major problems for the development of new drugs. And, you know, it appears that, you know, it's not like big blockbuster drugs are coming out a lot these days, and drug development's gotten more expensive, takes longer. So I think one way we could maybe impact it, you know, we mentioned the FDA. You know, are there ways in which we can speed up the approval process or create a process that is not as expensive as current drug development? So, but again, this is a much broader conversation. It's not about, you know, if we can re-import drugs from Canada, everybody's prices are going to go way down, and, you know, the sky's going to be blue. It's not that simple. It's very complicated. You know, and again, from our perspective, we would like all the interested parties that have ideas to be willing to sit down and negotiate. And in this case, you know, it's sometimes more the Democrats that are extreme on the approaches that might be proposed. So, you know, it's I think there are ways to address the drug pricing issue. We don't have a set of principles around it quite yet, but we are actually working on developing a policy around drug pricing that once that's done, we'll be, you know, educating the community on it.
Let me just pose one last question as a way of kind of wrapping up our conversation today. I ask you first to comment on it, Ted, and then Joe, I want to give the last word to you. The question is this from Tony. Does Congress ever use the great success of the Michael J. Fox Foundation against us as a way of cutting funding for Parkinson's research? It's an intriguing question because it's saying, well, come on, you guys are doing so great. You don't need the federal government. Respond, if you would, to the specifics of that, Ted. But then, Joe, I'd like you to also just come in and sort of give your argument for the kind of importance that is carried forth when advocates best tell their story, whether it's representing the Michael J. Fox Foundation or not. But Ted, on the question of how does MJFF success ever work against us?
Well, I'll put it this way, not that we know of, but then again, that nobody would ever say that to us directly. But that's why I earlier in the call mentioned that we have to take care in how we present it, because if National Institutes of Health funding for Parkinson's were to drop, what they fund is different than what we fund. They fund more basic research. We're the next step in the process, and then after us, it's the drug companies that take over the research. So there's a kind of a continuum there. So at this point, we don't see it as hurting us, but we, at times I say, the government should be embarrassed that we're funding almost as much as the entire federal government. So at this point it hasn't hurt us, but we do keep watch of that, and we also are concerned about the NIH. We don't want them to basically internally decide, well, the Fox Foundation can fund that, so we're not going to. So, we are in very close communication with NINDS. We have periodic phone calls and meetings, and trying to make sure that we're on the same page and that we're not duplicating approaches and things like that.
And Joe, a last word from you on what you'd like to encourage, I guess, others within the Parkinson's community to do to advocate our cause, despite our great success at the Fox Foundation, the kinds of viewpoints, the kinds of stories that we still need to tell.
Yeah, what I would say is this is the most important thing we can do for ourselves, advocating for ourselves, putting a story with a face with our legislators and making it real for them. I think I've been saying since I've been doing this, every American should find a reason to go up on Capitol Hill and to talk to their representatives. Certainly everyone with Parkinson, certainly every caregiver, certainly every son or daughter or mother or father who is directly affected by this should find a way to join the Michael J. Fox Foundation on Capitol Hill and within your own districts, and really fighting in a very real and very tangible way for the rights and for the policies that affect us all so personally.
Joe, thank you. Thanks for that testimony, and thank you also for all the work that you're doing on behalf of all of us. And also, of course, our thanks for participating in this webinar. Thanks to Tiffany Kazuba. Thanks, Joe. And thank you, Tiffany, for your participation, and of course also to Ted Thompson at the Michael J. Fox Foundation. Thanks all of you as well for participating in this webinar. We want to encourage you to come back to us on the third Thursday in September. That's September the 21st, when we'll be replaying one of our past webinars focused on the topic of gait and balance. I'm Dave Iverson. Thanks very much for joining us. Hello, everyone, and welcome to today's Third Thursday webinar from the Michael J. Fox Foundation. I'm Dave Iverson, contributing editor at the Foundation and the host for this continuing series of topics where we take up different aspects of living with Parkinson's disease. As always, we would welcome your questions during our webinar today. You can just type them in the box that appears in the middle of your screen and send them to us, and we'll do our best to cover as many of those questions as we can. Also, as always, there's our resource list, so you can click on that also on your screen and download that if you'd like to save these